I've treated thousands of patients with Morpheus8. And it's not just me. I have 8 other injectors / plastic surgeons, oculoplastics, OBGYNs in my practice. And it's become such a staple in my practice. It's the #1 procedure that we do in our office, in addition to injectables.
Well, we had the original Morpheus. We had the upgraded Optimus Max. I would say that we've treated a few hundred original Morpheus clients with exceptional results. We use photography to verify that. And with our new Optimus Max, we're able to have maybe about 5 or 6 clients since we were just trained on that August 1.
So I have treated approximately 2,000 patients at this point. So I've had it for about 5.5 years. I max out at about 5 a day. I don't let them put any more than 5 a day on my schedule, but we're at about 2,000 Morpheus treatments that I have done myself at this point.
We're a relatively new practice, so patient count may be 15 or 20, but each one of those patient counts, we do typically 3, sometimes 4 times. So we're upwards of 50, 60 treatments of Morpheus currently. And as marketing continues to expand, this week I know for a fact we have about 3 or 4 more bookings for Morpheus, so it does continue to grow.
I was going to say with each Morpheus patient too, not only are they doing Morpheus, they're also getting Lumecca, laser hair removal. Now they're all coming in for the women's health platform. So you're just keep bringing in patients.
So I've treated a ton of patients with Morpheus. On top of the 3 clinics that I have, all 3 of them have Morpheus technology. Whether it be body Morpheus, whether it be face Morpheus, whether it be vaginal Morpheus. So all 3 of my clinics stay very busy doing Morpheus. And the nice thing about that is that I don't have to be there for all that. It's an extender prep, so I'm able to make money while I'm not around.
So we have 3 Morpheus machines, 3, right? So we have the med spa, we have the practice, and in surgery, our surgery center. So we use Morpheus in the med spa, in the practice, and in surgery. I combine it with everything. So safety, I mean, we use it on all skin type. The majority of my practice is skin of color. So we have used Morpheus to do all kinds of stuff. We have thousands of patients treated, so we know it's very safe.
We've treated hundreds of patients. I've worked with that platform for probably the past 5 or 6 years in previous practices and now my own. When I decided to open, I wanted a machine and only machines that gave results, were safe, and would provide my patients with everything that they wanted. So that was why we chose that.
Hard to count. What I would say when we first got started as an eye care practice, we were starting with about 1 every other 2 weeks or so, but now we're up to at least, I would say, 3 to 4 a week.
I have treated Morpheus8 V for vaginal rejuvenation, Morpheus8 face, Morpheus8 body, pretty much the entire Morpheus8 technology.
We've done several thousand Morpheus treatments over the course of about 4 years, and a little over 500 face type procedures. And so for something that's I can delegate Morpheus, I typically delegate to a nurse practitioner, and that keeps her busy. And face type, which is done by myself.
Oh, we've probably treated about 500 patients over the years.
So we've had our Morpheus less than a year, so not even very long, but we've treated between face and body patients, probably over 100 patients with our device, so it's been good.
Okay, how many patients have we done with Morpheus8? I think in average, I think I have more than 2,000 patients, more in body, but we do also in face. I think it's a device that, for being as recent, it has been around like 2019 and all. It's a great device. I think it's the kind of devices that can be used by yourself, or you can actually delegate to someone else. It's very easy to use. The learning curve is very fast.